On to chapter 21. This is our last chapter in the cardiovascular system, and it really focuses in on the blood vessels, the pipes that are carrying the blood that the heart is pumping. We'll also take a little bit of time here at the end to kind of try to wrap everything together, right? Because these systems are absolutely integrated. The heart doesn't work on its own, the vessels don't work on their own. It really is a system. So we'll look at the integration there, but we will spend some time on arteries, right? And how the muscularity of them is able to adjust blood pressure to perfuse organs. We'll definitely spend time talking about capillaries, these teeny tiny vessels. I will tell you, this is where the action happens, right? The capillaries are the only vessel where diffusion takes place, right? Where oxygen and carbon dioxide are exchanged, where nutrients are exchanged. You have tons of capillaries. It's something like 10 billion capillaries, 25,000 miles of capillaries, and that is where the action takes place. We'll talk a little bit about the venous system because, of course, we need to get the blood back to our pump. So we will go through and talk about different sized arteries, we'll talk about capillaries, veins, but before we jump into these different types of arteries and veins, let's take a look at some things that they have in common. Oh, I did want to point this out. Because capillaries are the only vessel where diffusion can take place, we'll actually see that our large blood vessels, right, elastic arteries, muscular arteries, the medium and large sized veins, they're all so big that diffusion can't feed all of their cells. So much like the heart, they need their own blood supply. So we actually have this set up. It's called the vasa vasorum, and it's just a blood supply to the vessels, which again is a little bit counterintuitive until you really think about diffusion. There's really no cell in your body that's more than about 2 cells away from a capillary so that they can get the nutrients. Okay, so when we think about arteries and veins, they share the same 3 layers. The tunica intima is the interior layer that's actually touching the blood, tunica media, and then tunica externa on the very outside. So they both are going to share these layers, and let's look at some similarities, but also kind of what's different between these layers, okay? So on the left here, we're looking at the artery, on the right is the vein, and this is figure 21.1 in your textbook if you want to follow along there. So the tunica intima, this is really made up of the endothelium, remember that simple squamous epithelium that's lining the vessels, we call the endothelium. So the tunica intima contains the endothelium. We see that both in arteries and veins. Now, under that simple squamous epithelium, just like anywhere else, you have this like basement membrane, right, a little bit of connective tissue. And here on the arterial side, you'll see some squiggly lines, and that's trying to indicate some more elastic fibers than you see on the venous side, right? So in fact, they call that the internal elastic membrane, right? These squigglies that are just deep to the endothelium, right? But that's what's going on in the endothelium, in the tunica intima, which contains the endothelium. Now, when you look at this histologically, they also tried to show you, because there's so many more elastic fibers in an artery, they're trying to show you that the arteries tend to recoil, right? Those elastic fibers, just like a rubber band, kind of squeeze it back together. And so the endothelium often kind of gets tossed into little ripples. Here on the venous side, where we don't have those elastic fibers, it tends to stay nice and smooth. Okay, if we move out a layer, we get into this red layer, which is the tunica media, right? The tunica media is the muscular layer in these arteries and veins. This is made out of smooth muscle, right? On the arterial side, that tends to be thicker than on the venous side, right? And this is going to be what allows arteries to change their dilation, right? If they vasoconstrict, if they squeeze down, or vasodilate. That can also happen in the venous system. It's venoconstriction, venodilation. It's just not near as I don't want to say important. We don't talk about it near as much. Maybe it's not quite as important because the diameter of an artery is going to determine basically where blood flow is occurring. The other thing I wanted to point out, so that tunica media is a little bit thicker on the arterial side, and then again, it's got all these little squigglies. They're trying to show elastic fibers. In fact, they even talk here about this external elastic membrane. Again, it's important for the recoil of arteries to have all these elastic fibers. If we move on to the tunica externa, kind of this flesh-colored layer on the very outside of our vessels, right? It's primarily connective tissue. Its job is to anchor our vessels into surrounding tissues. So as you're dissecting in lab, you'll find that you're going to have to use something like a blunt probe and kind of trace along the arteries and veins to pull them away from the surrounding tissues, right? And the tunica externa is part of that anchoring. Basically, collagen is the dominant connective tissue. On the arterial side, again with the squigglies, there's some elastic fibers there. Really, on the venous side, it's collagen, and you actually have a few smooth muscle cells embedded there as well. And so then, just to bring it all together, you'll be looking at this histology in lab, but notice what these differences do to our vessels histologically. So again, you can see here in the artery, that wall is much thicker. Most of that is tunica media. We see that the artery has kind of recoiled here, right? It tends to keep its shape. It's much more rounded. If you look even closer, right, if we zoomed in a little further, you'd see the folds there in the endothelium. The vein then, it tends to be larger, kind of floppy, nice and smooth on the inside. So you'll be looking for that in lab. All right, so as we focus in on the arteries, remember this is the side where the tunica media is really dominant, right? We have a lot more smooth muscle in arteries than veins. And we say that's really important as far as vasoconstriction and vasodilation, right? How much blood is able to move through these vessels and how much resistance that faces. Now, our elastic arteries, these are our largest arteries. Think the aorta, for example. These are about an inch in diameter, right? An inch is about the length of your knuckle here. So these are really big vessels, right? Elastic arteries are called this because even as you look at the tunica media, there's a little bit less smooth muscle and more elastic fiber. These vessels, one of their big jobs is kind of dampening this bolus of blood that's coming out of the heart, right? So what we want to do is not have, like when we get to the capillaries, we don't want like a rush of blood and then nothing, and then a rush of blood and nothing. We want continuous blood flow. And so these elastic arteries are going to kind of absorb that big bolus of blood coming from the heart and try to dampen the ups and downs. So we have continuous blood flow. And the elastic fibers are good for that. They're also sometimes called conducting arteries. These are the conducting arteries because they're just taking it to a different area of the body. Now, as those arteries start branching off into smaller arteries, those next arteries would be muscular arteries, right? Absolutely dominant tunica media here, right? This vessel is all about being lots of smooth muscle. These would be things like the brachial artery in your upper arm or the femoral artery in your upper leg. Some of you might recognize these as the vessels we use as pressure points. So they're very thick muscular arteries. It takes a lot of pressure, but really if you can push this vessel flat, you can cut off blood flow or at least dramatically slow it past this point. The muscular arteries are sometimes called distributing arteries because it starts to take the blood to certain organs or to a certain area in the body. Arterioles are really small, the smallest of really our arteries. You'll notice a couple things. It's pretty much lacking that tunica externa, right? In fact, even the tunica media is really just 1 or 2 smooth muscle cells thick, kind of loosely organized. But this is actually the blood vessel level where vasoconstriction, vasodilation becomes the most important. This is where that control takes place. Again, the sympathetic nervous system is going to lead to vasoconstriction. Parasympathetic nervous system leads to vasodilation. From the arteriole, blood is then going to flow into capillaries. Now there's a few different kinds of capillaries. This is kind of your standard capillary. We call this a continuous capillary. And all that's referring to is basically you have this complete ring of endothelial cells, right? Simple squamous epithelium surrounded by a basement membrane. Remember, the basement membrane is just some connective tissue that's always adjacent to a simple squamous epithelium. So notice the boundary between cells, there's not a lot of room there. Basically anything that's going to come out of a continuous capillary is going to actually have to migrate through that cell, right, one way or the other. So that's a continuous capillary. Now this would be standard, so this would be like, say, in skeletal muscle. We would find some specific, maybe more specialized versions in the brain, right? So if you recall the blood-brain barrier, we have continuous capillaries, and in fact we'd add some tight junctions, right, to really make sure these cells aren't letting anything pass between. And then of course with the blood-brain barrier we have astrocytes adding those little foot processes, right, to surround the vessels as well. This is what we call a fenestrated capillary. So notice it looks very similar, right? Endothelial cells surrounded by a basement membrane, but now we have fenestrations, and that's just a fancy way to say a pore. But there are small holes that certain items can basically move freely in and out of our capillaries. We would find fenestrated capillaries in places like the small intestine, right, where absorption is really important. We find them in the kidneys where we're using it for filtration. And there's fenestrated capillaries in your hypophyseal portal system. Do you remember that? Those were the 2 capillary beds, right, that connected the hypothalamus and the anterior pituitary. And so we use fenestrated capillaries there because we're trying to very quickly move hormones from the hypothalamus to the anterior pituitary and let them have their action. So that's a fenestrated capillary. Finally, we have what are called sinusoidal capillaries. Now these are all sorts of gappy, right? So they still have the fenestrations, the pores, but then notice there are these big kind of gaps between adjacent cells, right? This is really letting things move in and out of these capillaries very easily. You would find sinusoidal capillaries in places like the liver, the spleen, and bone marrow. So capillaries are arranged in what are called capillary beds. So up here we see a single arteriole, right, feeding this whole meshwork of capillaries. That's a capillary bed. Now you can have what's called a collateral arteriole, so there can be neighbors, so if one gets blocked, the other can keep supplying that capillary bed. And capillary beds, when you're at rest and those cells don't have huge metabolic demands, you really only have blood flow flowing through about 25% of a capillary bed. What we do is at the openings, you have what are called precapillary sphincters. So you have little sphincters, little rings of muscle that kind of can divert which portion of that capillary bed is getting blood flow. Now, as activity increases, we start getting more coordination in how these sphincters are working, and we really do our best to kind of spread that blood flow out evenly and make sure all the cells are getting the oxygen and nutrients they need. If a cell is hypoxic, if it doesn't have enough oxygen, it can actually release growth factors. So vascular endothelial growth factor, or VEGF, vascular endothelial growth factor is a growth factor, right? Remember paracrine communication, really just calling out the need for more blood vessels. And this leads to angiogenesis, the production of more blood vessels. Angiogenesis, right? Genesis, origins, angio, just like you might think about, it's a root referring to vessels. So we can develop more capillaries, and in fact we do see that, say particularly in highly trained athletic individuals, right? So that's how our capillary beds work and are arranged, and of course at the far end then, that blood, right, has given up all its oxygen, picked up CO2, maybe some waste products, and we're going to return to the venous system. Now, at capillaries, hugely important to remember, this is the only vessel where diffusion takes place, right? So where nutrients are exchanged across a blood vessel wall. And so what they're trying to show us here is how things can move in and out of capillaries. Now let's look at, okay, this is a super important picture, and it explains a lot of things, but students tend to get a little confused. So let's lay things out. This is trying to show you a generic capillary bed, right? So arterial, capillary, venule, all right? So keep that in your mind. It's just trying to simplify what a capillary bed looks like. Now, they're showing you how pressures differ across a capillary bed. So these pressures, we have hydrostatic pressures and colloid osmotic pressures. A hydrostatic pressure is the pressure of a fluid, right? So in this case, we'll see a lot of this being basically blood pressure. So early on in the capillary bed, capillary hydrostatic pressure is greater than blood colloid osmotic pressure. What's that? A colloid osmotic pressure is, right, colloids are going to be some of the things that are in the plasma, right, that are actually drawing water into plasma. So bigger things like proteins and cells that aren't going to be able to escape. So early in a capillary bed, it's actually the blood pressure overpowering the drawing force, right, that the proteins that might hold fluids into the blood. And so we actually see filtration. That's what this picture was trying to show you, capillary filtration. When hydrostatic pressure is big, it's squishing things across that capillary wall. Again, particularly more if you're looking at a fenestrated or sinusoidal capillary, right? But notice it's all these small solutes, glucose, some ions that are getting pushed out, but what stays behind are bigger things, amino acids, proteins, right? Our cells, things like that. So in a capillary bed, again, we start out with filtration. And in fact, this is huge, right? In all the capillaries in your body, on average in a day, you're actually squishing out 24 liters of fluid across these capillary beds. Now, if that fluid did not get pulled back in to our blood vessels, you would be huge and swollen all the time. So at the far end of a capillary bed, the pressure has declined, right? Blood pressure drops as you move through these small capillaries. But what has increased is colloid osmotic pressure, right? Who stayed behind? A bunch of fluid got pushed out of the capillary, and what stayed behind were large things like proteins, right? Albumin is really good at drawing fluid towards it. So now blood colloid osmotic pressure, those proteins are pulling the fluids back in, and it's stronger than capillary hydrostatic pressure, and so we get what's called reabsorption at the far end of this capillary bed. So early in the capillary bed, filtration dominates, right? And that pushes fluids out into the interstitial fluids, kind of bathing the tissues. But then we reabsorb most of it. We draw it back into the capillaries before we move on to the venous system. Now, you might be noticing that 20 is less than 24, right? There's about 4 liters unaccounted for, and that's where the lymphatic system is going to come into play. So we'll look at that soon. Notice right here in the center of the capillary bed, they're just trying to say, hey, these pressures kind of balance each other out, and there's no net fluid movement one way or the other. Now, if this is confusing, ask me about it in class. We can talk about this more. This is one that students have a hard time with, but it's super important, right? It explains why, say, someone whose liver is failing ends up with huge amounts of edema. Think about that. Why would someone in liver failure end up with edema? Well, it deals with how these pressures change and how that causes fluid to move out or into our capillaries. From our capillaries, we're going to move into the venous system. Now, the venous side of circulation is under much lower pressures than the arterial side. It's something like 10% of the pressures we're going to see on the venous side, as we did, say, in the aorta, who was receiving really that huge load of pressure from the heart beating. So from our capillary, we're going to move blood into venules. These are the smallest of our veins, and they're really just, they kind of look like a capillary wrapped in a little bit of connective tissue, right? They're really small, very thin-walled, and they're starting to collect that kind of deoxygenated, at least from the systemic side, they're starting to collect that blood that has moved through the capillary bed. Okay? From there, blood's going to flow from a bunch of different venules into a medium-sized vein. So we see this getting a little larger, but it's still, right, a very thin layer of smooth muscle in here, right? It does not look like an artery of the same size, right? It's very pliable, likes to flatten out. There's not a huge pressure inside of it holding it open, but we're collecting that blood. We then return it to these large veins, so you start thinking about things like our vena cava, superior, inferior, returning this to the heart. They are quite large, still low pressure, and still comparatively very little muscle. That tunica externa is really the dominant layer here. Now, one other thing that veins have that we did not see on the arterial side are valves. So these valves are really just flaps of the endothelium. It's a continuation of that tunica intima. And the way this works is, again, they kind of look like those semilunar valves that we saw in the heart, these little t-shirt pockets. Basically, as blood is flowing past them, they're very flexible. Those valve flaps get kind of pushed against the wall. But then as blood tries to settle back, right, particularly if gravity is pulling it down, it fills those pockets and the valve closes, preventing backflow. This is super important in the venous system because we are under such low pressures, right? So we're trying here in the leg, we're actually working against gravity to get this blood back to the heart without exerting lots of pressure. Now, the muscle actually aids this pumping of blood. So we talk about this skeletal muscle pump, right? Every time this muscle is contracting, it's able to squish blood past it, and then the valves are preventing the backflow. And in fact, when that blood gets into, say, the thoracic cavity, it's actually our breathing. We have a respiratory pump. Breathing is actually helping kind of squish the blood back to the heart, and valves in the vena cava are preventing the backflow.